Well, we were diagnosed on Halloween. We thankfully got our trick-or-treating in done first, right? Yeah. And then we got some blood work back from a doctor's visit we'd had the day before. He had kind of run some low-grade fevers for about a week, and being a leukemia patient myself, I kind of had, I'm just aware of little tiny things to look for, and something felt off. And so we went to the doctor the day before and had some blood work done. And they called us back after we had finished trick-or-treating and let us know that it looked kind of funky and we had some sick blood we needed to take care of. Unfortunately, I'm a seasoned cancer patient. I was diagnosed with breast cancer in 2018, right after he was born. And then 2 years later, at the beginning of COVID, I was diagnosed with FLT3 AML. So some of this was familiar to me, and that was kind of a double-edged sword because instead of it just being all new and getting little bits of information along the way, it hit me all at once because I knew what he was about to be dealing with. So the clinical trial that they signed us up for is through the Children's Oncology group, and they are studying the effects of different dosages of blinatumomab in the treatment of B-cell ALL.
When we meet a child with cancer, we, and I'd say pediatric oncologists across the country, really think of any child with cancer as potentially eligible for a clinical trial. And because childhood cancer is so rare, we really feel strongly that children should participate whenever possible so that we can learn as much as possible from each child. There are about 2 million people diagnosed with cancer in the United States every year, and of those, only 13,000 are kids. So it really is rare. The goals of this trial are to see if we can cure more children with average risk ALL with the addition of this newer drug called blinatumomab. So blinatumomab has been shown to be very effective in treating both children and adults whose ALL has recurred, but it's never been used in the upfront setting. So this trial will answer the question, can we cure more kids with ALL if we add blinatumomab to standard chemotherapy?
All the doctors and nurses have been wonderful, and they have been very responsive. I think I have appreciated a lot how involved the children are in their own care. Meeting all these children that are going through what they're going through, it's like the empathy that is just naturally built into them is just an amazing thing to behold. They are always sharing and welcoming to each other in the treatment room and want to play together, and it's just really neat that they all understand, and no one had to tell them to be kind to one another. No one had to tell them to be compassionate. It just happens naturally, and I feel very privileged to get to sit in there and witness this, and I just can't wait to see all these kids grow up and what amazing adults they're going to be.